Good morning. I'd like to call the first meeting of the Senate Insurance Committee for this new term. We have 6 new members. I think you'll find this committee very fulfilling. We appreciate you all being here this morning. The first thing we're called for today is to organize the committee. We have 3 separate motions that Vice Chairman McClendon is going to make. So, Vice Chairman, your first one, please.
Thank you, Mr. Chairman. Committee, first motion I'd like to make is to move to elect Senator Brian Rhodes as secretary of this committee, being the freshman senator, and he's so eager to be able to make a difference.
It was a tough race between he and Senator Blackman, but Senator Blackman was already loaded up twice with 2 committees. All in favor of that motion, please say aye.
Aye.
Any opposed? Senator McClendon.
Thank you, Mr. Chairman. Second motion I'd like to make is to move to adopt a quorum of 7 members, a majority of the committee as sufficient quorum to proceed with business.
All in favor of that motion, please say aye. Any opposed? That will be adopted.
Next motion, sir, Mr. Chairman, I'd like to adopt the rules of the Senate as the committee rules of procedure, with the exception that a motion to reconsider may be disposed of on the same day as it is entered.
Any discussion on that? All in favor, please say aye.
Aye.
Any opposed? Okay, I would like to also reiterate our policy that you've probably heard at some of your other organizational meetings about participating by Zoom. We're glad for you to get the link and participate by Zoom. You'll be able to ask questions, but you will not be able to vote by Zoom. So your vote must be in present in order to be recorded voting on an issue. Okay. All right, we also come before us today to discuss a bill on prior authorization. Those of you who are on the committee last 4 years, that's a term that should not be unfamiliar with you. We had this bill and it passed the committee, I believe it was unanimously, and it passed the Senate floor. The bill defines the parameters under which a healthcare provider must receive prior approval in order to perform a medical procedure. The bill passed, as I said, this committee, and it passed 49-0 on the floor last year, and the bill was vetoed. And Senator Kirby and I went and met with the governor. It was vetoed with plenty of time left in the session to make some changes and try to revise the bill. And we asked the governor to give us any suggestions that he would have to improve the bill to where we could bring it back up and act on it last session, but we received nothing from the governor. So we have before us today the bill to allow all parties to give their input. A week before we came into session on December the 28th, I gathered interested parties on this legislation. I want you to know who all I included. Representatives from the governor's office, representatives from Division of Medicaid, representatives from managed care plans, from insurance companies, from physicians groups, from the Mississippi Association of Health Plans. Insurance Commissioner Cheney was present, Pro Tem Kirby was present, and the Director of Finance that oversees our state health plan was present. And that's important because one of the governor's requests was that we include the state health plan in this prioritization process. So the Director of the state health plan was present as well. So that brings us to Senate Bill 2140 that you have before you. Sorry, I'm going to be repetitive for those of you who served on this committee last 4 years, but for the new members, we had complaints from both sides on this issue in the prior authorization process. We had complaints from medical doctors that oftentimes the approvals took too long to receive. We also had complaints that oftentimes a medical doctor was talking to someone clerical with an insurance company who was not qualified to discuss the knowledge involved in the procedure that they were wanting to perform. On the other hand, we heard from health insurance companies. They said that one of the reasons that maybe the procedures were delayed was because the doctors were not filling out the forms properly, and that was the cause for the delay. So what we're doing in this legislation is setting up a web portal to help both parties. And in this portal, by January 1st of 2025, the insurance company must set up the portal. By January 1st of 2027, all are required to use it. There's 3 categories of medical cases defined in the bill. One is emergency care. I think we all know what an emergency is. An emergency does not require a prior authorization. We're talking about a heart attack, a severe auto accident, severe lacerations, things that must have immediate care. The other two categories are urgent and non-urgent. In an urgent prior authorization request, it must be rendered within 24 hours of receiving the information. Okay, that's important. We want the health insurance provider to have all the information required. That's why we're setting up this portal, so we won't have a delay. So if the doctor delays on getting the information in the portal, then it delays the process. For a non-urgent situation, the prior authorization must be rendered within 5 days. Again, the meter doesn't start running until all the information is entered in the portal. All right, if the procedure is approved, then everything goes on as planned. The medical procedure occurs and the arrangement for payment for the services by the insurance company is granted. In an adverse determination, we've given the physician an appeal process. And as I mentioned earlier, in the appeal process, what we want to avoid is a physician who's been in medical school to possibly as late as early 30s, dealing with someone clerical who doesn't have the level of knowledge. So we've given that physician the right and the obligation to be able to speak to someone knowledgeable on the subject on the other side, and it must be in that specialty. We don't want an orthopedic issue being determined by a cardiologist or an OBGYN. We want a cardiologist to be able to speak directly to another cardiologist knowledgeable on the subject. The insurance companies, on the other hand, said that one of the problems with the bill might be that there's a limited pool of specialists in Mississippi on some of these cases where we need a prior authorization. It could be very specialized. So we opened up that pool of medical doctors to anywhere in the country, so long as they're knowledgeable in that specialty of the subject being appealed. All right, another change at the governor's request was that we move this authority in this act to the Department of Insurance. We have done that. Commissioner Cheney will be involved overseeing the PA process. It formerly was listed with the Department of Health. In the legislation, the Commissioner's Office can fine violators up to $10,000. In the original version of this legislation, that was as high as $250,000. We've come way down on the fines to try to appease the parties. And that fine, if paid, if authorized, and when paid, would be administered to our state general fund. All right. Also, the insurance companies, we want to report how this process is going. So by June 1st, 2025, and each June thereafter, we want the companies to report statistics to the insurance department, and we'll be able to determine if any improvements, if we need to come back and make any improvements to the portal. Now, some of the things we want to know is how many prior authorizations were approved, what percentage of them were denied. We'd like to know if any of them, the ones that were denied, were appealed. We'd like to know the ones that were appealed, if they were successful on the appeal. On the other hand, we want to also know if there's any bad actors there in the medical community. If a prior authorization was given for a specific procedure and the doctor did not perform what was authorized, then we sure want to know that as well. Are there any questions? I'd be glad to yield to any questions. That's a summary of the bill. Senator McClendon, do you have questions, Senator Huber? Suber?
Thank you, Mr. Chairman. I know this bill was vetoed last year, and I appreciate your explanation of kind of the differences. Is there going to be any cost to this legislation on the state plan?
We don't know. We put the state health insurance plan in because there's several 100,000 people, and we want them included in the plan. And we did agree with the governor. That was in his veto. That was in his discussion. I don't believe it was in the veto message, but he made it clear he wanted the Department of Finance and the state health insurance plan to be included.
And last year it wasn't included. Is that right?
That's right. We had them excluded last year. Any other questions? Senator Clinton for a motion.
Title sufficient, do pass.
Motion is title sufficient, do pass. Senate Bill 2140. All in favor, please say aye. Aye. Are there any opposed? Senator Clinton, move we rise and report.
Rise and report.
Move we rise and report. All in favor? Aye.